This isn't Ron Eimer's first trip to see the specialist at the Avera Heart Hospital.
Well, 22 years ago, I was down here because I had a leaky valve.
His extensive medical history includes atrial fibrillation, open heart surgery, and even a Watchman procedure to help keep his heart health in check.
Now, initially, he was not having any symptoms, was doing fine, but through serial evaluations and keeping track of him, when he started having problems with heart failure and fatigue,
I was getting dizzy and stuff like that, and that's when they found the leak in my heart.
Ron's tricuspid valve was malfunctioning and allowing blood to flow backward, causing him to feel winded and fatigued.
the tricuspid valve is a little bit more complex of a valve from an anatomy standpoint. And so we didn't have really any good devices at the time to try to treat this problem. But a lot of patients who have mitral regurgitation or aortic valve stenosis can also have tricuspid valve regurgitations.
Thankfully for Ron, there's a new minimally invasive option to help treat his condition.
He did a lot of testing before he did this, which I admire. We made a lot of trips down here, but finally he said we got to go out there and put some. He said like clips on it, like clothespins.
So the TriClip is similar to MitraClip. It's a clip that we put on the leaflets to try to bring them together so the valve no longer leaks. The TriClip device became FDA approved in April, and we were fortunate enough to be one of the early adopters for the procedure.
I'm only the second or third one they ever did, I think. I didn't know that till it was after it was over with, which is fine. I knew I was in good hands. Dr. Wagner is really thorough. I'm really happy with him.
This is not open heart surgery, and the valve repair can be done through the body's own blood vessels in the cath lab, rather than an OR, meaning an opportunity for a quicker recovery for patients like Ron.
Now with this device, it's a tool in our tool belt to help treat this. Not everybody's a candidate, but it does give us some options to address tricuspid regurgitation that's persistent despite medications. And fortunately, we're at a place at North Central Heart and the Avera Heart Hospital that advocate to staying on the front edge of this type of treatment. And so we're very fortunate to be here. There's a lot of things we can offer, whether it's, for AFib, valvular disease, vascular disease, cardiac disease in general.
As for Ron, he's on the mend and looking forward to returning to the hobbies and the people he cares most about.
Yeah, I did some pheasant hunting. I didn't get it too good luck, but I got a grandson that's going to come deer hunting with me. So maybe I can live another 20 years. I don't know. I hope. I'm 76 now, and I'm hoping I can live longer.